I'm really proud of the work that we do at Volunteers in Medicine. Since the day I started, it's been very clear to me by our staff and our volunteers how important quality is to providing patient care to the working uninsured. We're not just a free clinic, we're a quality free clinic. And at the same time as we're providing this quality care, we are still providing compassionate care. We're still providing a loving environment for our patients.
My first visit, I came in, everything was great. You know, everybody was really cordial and nice. And I met with, I believe it was the nurse practitioner, and she was like, we're gonna get you set up for your women's appointment, we're gonna get you set up for vision. And she just started naming all the things that they could do for me.
Stephanie has been here in the clinic since November of 2021. Her blood sugar is controlled, so she has that hemoglobin A1C now of 6. She improves and she does great, and then she will have trouble again. And then she improves again. I think the important thing for her is that she has a medical home and she has someone to take care of her when she goes through those slumps.
One of the things that I've learned is that for healthcare and other business, you have to look at the whole person. So to make changes, you have to talk about changing your eating habits. You need to look at changing how you are getting outside and engaging in the world. You need to look at the medication. So you have to encompass the whole person, not just one aspect of them. When I first came to Volunteers, my main concern was the blood pressure. But because they offer a variety of services, I walked out with mental health services. I walked out with orthopedic. I've seen the dermatologist, ophthalmology. I get my glasses now through Volunteers. So I have walked out with a lot of medical services.
I think and know the quality of care here at Volunteers in Medicine is second to none and outstanding. We are able to provide, and we do use evidence-based medicine. We also have a comprehensive quality assurance committee that we meet quarterly to evaluate how we're giving care. We use dashboard measures that are national and benchmarking, so we give outstanding care, and we absolutely follow through on that with our quality assurance measures and meetings.
Since I've been coming here, my health has been much better. I've been taking care of myself. Like now I know like what to eat, what not to eat. You know, like control yourself from overdo things that you don't have to do.
I first met one of my patients, Elvis, a few years ago. And when he came, he had hypertension, high blood pressure, that was somewhat controlled. He did not have access to care, so he didn't have medication, so he was trying to manage his blood pressure with diet and exercise. Once we were able to get Elvis to trust in taking medication and getting his high blood pressure controlled, we were able to spend some time talking about preventative medicine. An example of that is we were able to get him set up for a screening colonoscopy to ensure that he doesn't have colon cancer. We also made sure that we checked routine screening, kidney, liver, prostate. So we've been able to now move into screening as well to make sure holistically he's healthy, both physically and emotionally.
Without Nina's guidance, I wouldn't be able to do this colonoscopy, and I would never thought about doing any exams like that. And thanks to her, she opened your mind, like, you know, how to be in good health and good condition. And she's just been a great doctor ever since I know her.
The major difference between Volunteers in Medicine and many of the other organizations in the city, Volunteers in Medicine takes care of patients who have no health insurance. 15% of the people in Jacksonville have no health insurance. Volunteers in Medicine helps take care of an important part of that group. Those who work 20 hours a week or more, hardworking people that cannot afford health insurance. And those people would not be able to be seen at other facilities unless they had the money up front to pay. And that's the big difference about Volunteers in Medicine.
I came into Volunteers in Medicine and my doctor referred me for a mammogram through a program, and the quality was excellent. And they were always able to make me feel rather comfortable because I had a cyst that was acting like it was something more. The doctor would, examine me and she'd say, I don't like this. And so I'd go up there and they would do the mammogram yearly until we found out that it went away.
Most patients are appreciative of the care you give them and make progress. It's always neat to be part of a person getting better, getting to a goal, being part of the process of someone being successful in their medical care.
I would just say I thank them for everything. There's not any one certain thing, it's everything.
I thank Volunteers in Medicine for taking care of me, for giving me a chance, to take care of my health and just be there for me.
I would like to say thank you to Volunteers in Medicine. I'd like to say thank you to Dr. Findley for being the doctor that she is and for caring the way she does, and to Dr. Jarambi for making herself available to me on the weekends when I was in crisis. So thank you, thank you, thank you.
Our new patients get a full hour with our doctors. And then every visit after that, they get 30 minutes with the doctor. And what happens as a result of that is they build a relationship. I've seen it with Carla, with Stephanie, and with Elvis. Their relationships with their doctor. They talk about them by name. They say hello to them when they see them. And Dr. Findley, Nina, and Dr. Ober, they really enjoy those relationships because the patients listen and they can remember what they said at their last visit and they make adjustments together. I'm so proud of what Stephanie and Carla and Elvis have been able to do for their lives. And those are just 3 stories out of over 1,200 stories that we have.